Hey everybody, this is Ryan Phillips, Executive Editor of Starkville Daily News. I'm here with Dr. Cameron Huxford from OCH, and we have just had our latest update where we've had 5 confirmed novel coronavirus COVID-19 cases for Oktibbeha County. And I have Dr. Huxford here who's going to give us some more context on that and kind of give us a breakdown as we go into just another big day of developments and things like that. So yeah, I know you've been busy. If you just kind of want to give us a rundown of the last couple of days.
Yeah, good morning. Yeah, we've done a lot of testing through our drive-through, but there are other providers in town that are also doing their own testing. I did check with the hospital first thing this morning, and even with those 3 new cases, bringing the total to 5, none of them are admitted to the hospital. We currently don't have any who were suspicious of the infection currently in hospital.
Okay, and I know that y'all have the drive-through testing going on here at your clinic. If you want to talk a little bit about that for folks.
Yeah, there's a lot of people coming from all over, really, our service area, and all you really need is a doctor's order, and then the doctor's office provides the other information, paperwork, insurance information, so we can have access to that. But you just have to go to your regular provider, and if they deem it sufficient for you to be tested, they'll order it.
Okay, I mean, I'm sure during all this too, I know we've already received a bunch of emails, feedback at the paper with just people that are concerned. What have been some of the concerns that maybe folks in the community have asked you that you feel like we would need to address to kind of dispel misinformation or anything like that?
Well, even things that I've read and heard that we're running low, or we're not going to have enough ventilators or equipment. At this point, that's unnecessary worry. We don't even have a sick patient in the hospital with the virus. So for us to be concerned about not having enough gear is not pertinent to our current situation. That can change, and we let everybody know that, but the hospital is currently well prepared for this.
Okay, and in terms of any special measures, I know that y'all have like limited certain access points, things like that. What are some of like the logistics of that you think people in the community should know if they're wanting to come get treatment or get checked?
There's 2 access points to the hospital right now. One is the outpatient admissions, and one is the ER. All other doors are closed except to staff. You will be screened on entry, your fever checked, and asked about symptoms before you're allowed to come in, and there is a visitor limit too. So I would urge you, if you really don't need to come to the hospital, there's no reason to come right now.
Okay, and like for the people at home too, because I know this isn't something that just happens overnight. What would be some like the symptoms they should look for? Just to remind folks to kind of be self-aware and maybe not get their symptoms mixed up with like allergies.
Right. There's the classic symptoms that I'm reading about and that I'm sure you've read. One of the key ones is fever, and so if you haven't had fever, like documented fever, and for us that's greater than 100.4 degrees, then you probably don't have the coronavirus. Seasonal allergies will cause some of the sore throat and cough and things like that, but the fever, cough, and shortness of breath in some degree are the classic coronavirus symptoms.
And I don't know if we've gone on this, but kind of in that same vein, with some of the etiquette for folks who are coming to get tested. Do they need any kind of, I mean, I know you said like a referral from like their primary care provider. Right. Is there anything else they need to know?
They just need to know to stay in the car. We're coming to the car, you just stay in. Our staff is masked, gloved, gowned. We're protecting ourselves, so just stay in the car. And once you are tested, it's presumed that you were sick enough to be tested. You have to go home, and you should go home and self-quarantine for 14 days.
Okay.
Until we call you with the results.
For sure. And I've had some different submitted questions too from readers. A big one I think is people are being cooped up right now. I think that they just feel like their options are limited. One question I've gotten multiple times is, can people go outside, just for a walk?
Yes, I think it's good. I mean, fresh air is very good, so I think it's good to walk. I mean, avoid, close contact with people, but walking around the park by yourself, walking down the street, the new sidewalks we have, that's still a safe activity.
And you would say the same for like going to the grocery store, right? As long
Yes.
as you're practicing that social distancing. I know that has a lot of other people concerned too. That that we do still have certain essential stores that are open, gas stations, things like that. So you'd say that would kind of be the same thing.
I would say so, and then, once you've gone in the store and shopped, and make sure you come home, either use hand sanitizer in the car or wash your hands real good when you get home before handling your food and other items.
Okay, and one of the last questions I had, again, it was just submitted from a reader, is with the new resolutions that are coming down all over the country. It's not just limited to us, that are limiting houses of worship to 10 people. Why is that important? Because I think a lot of people that's messing with their routines. But I do think y'all view it as important to maintain.
I think it is important. I think for most places of worship, you're going to have more than 10 people. Oftentimes you will have a full complement of ages. You'll have young but also old, and we know that the older folks need to be protected. And most of the churches are doing an online version of it. My family, we watch church on TV Sunday. And so it's a unique situation, but that's a good opportunity.
And I mean, is there anything else that you want folks out there? I know we're about to enter some really uncertain times here in the next couple of weeks. Even in the next day or so, it's really hard to prognosticate what's going to happen. Is there anything else that you think folks out there need to know as we go into these next couple of weeks?
I think the data and the information changes by the moment, and often you can be fearful about what you're reading, but I just urge people to just not be afraid. It is still, for the most part, the chances of you getting it are limited, but then if you get it, for the vast majority of people, it's a mild illness, so there's just nothing to be afraid of at this point. Just be careful.
All right. Well, I want to thank you all for watching this. I'm Ryan Phillips with Starkville Daily News, and follow us